Hello, and welcome to the first ever WHO Western Pacific Region Partners Forum. My name is Angela Pratt, and I am delighted to be your moderator for this event over the next few days. We are thrilled that there has been so much interest and enthusiasm in participating in this forum. Over 950 partners have now registered to take part from over 50 countries all over the world. If you're here with us now watching this live stream, please let us know that you're there by giving us a like, or even better, if you haven't had a chance to do so, please leave a comment in the comments box below, introducing yourself and telling us who you are and where you're from. Now, over the next 3 days, we are going to be discussing the big health challenges and the big health issues facing our region today and in the future, and how we can work together to address these. We'll be discussing health security and antimicrobial resistance, non-communicable diseases and ageing, climate change, the environment and their impacts on health, and of course the unfinished business of infectious disease and infant and maternal mortality. Just like at a regular face-to-face meeting, there'll be a series of different discussions that you can jump in and out of as your time permits. We encourage you to join as many of those discussion streams as you can over the next few days. So now let me introduce you to the people who are here with me in Manila at our Western Pacific Regional Office. First of all, Dr. Takeshi Kasai, who is of course the WHO Regional Director for this region. Dr. Patrick Asawe, who is the Chief of the Asian Development Bank's Health Sector Group. Dr. Gundo Weiler, who is the WHO representative here in the Philippines. So you'll hear from each of them in just a moment, and if you have any questions that you'd like to ask the Regional Director, Dr. Asawe or Dr. Weiler, please leave them in the comments box below this live stream, and we'll try to get to some of those in a minute. So let's begin. To start, I would like to invite the Regional Director to talk to us a little bit about how he sees those big health challenges facing the region and why partnership is so essential to addressing them. Dr. Kasai.
Well, thank you very much, Angela. You said 950.
That's right, yes.
I'm so pleased to be here with you, and I'm so happy to know that so many partners are interested in engaging with us in the coming few days. And Patrick, really thank you very much. I'm so honored to hear that such a number of people are interested in our vision or our priority of Western Pacific regions. I have three messages I wanted to share at this opening. First, I wanted to share what I was told, what I heard in the past 5 months. I took up my office in February, and in the past 5 months, I've traveled 20 countries, and I had a lot of exchange with the ministers, senior officials, governors and their staff, partners, sometimes even the village chief. One thing I noted visiting all those countries that our region is very, very dynamically changing. And of course, they share different challenges they have. Every countries are so different, but I found 4 common things. One is that they're so concerned about the health security, such as infectious diseases or antimicrobial resistance. Recent 2 out of 4 influenza pandemic occur from our region, so it's understandable. The second is we call non-communicable diseases such as hypertension or diabetes. This is really the future which is already occurring. And if we think about how quickly our region is aging, it's also understandable. This is their concern. And third is environmental issue, health impact of the climate change. Again, if we go around the Pacific, it's not the scientific argument. It's their feeling that they have to address these issues. Every country is different, but these 3 are common. But as I said, every country still has specific issues that they have to address. Now let me temporarily call this as unfinished business, such as tuberculosis or maternal child health issue. And they're also so keen to address this issue. So those are the 4 themes that I keep constantly hearing from those leaders. This is the second message. But yes, the common theme, but they wanted us to address differently. In the past, we often provide the advice of what, but now they wanted to work with us on how. And in the white paper, there are a couple of language that maybe English native people feel a bit strange, such as backcasting or grounds up. We intentionally introduced this language. Some of them we borrow from other area, like economy. But we wanted to really use this language to provoke our discussions, because, as I mentioned, our region is moving so fast. So if we only respond to the issue today, we're always late. And there's so many innovations coming in. And if we don't pay attention to that, we're late. So we need to come with certain language to provoke those things. And also in the rapid, in the time of rapid change, it's also good to go back to the basic. And that's the reason why we also wanted to emphasize like community, people, community, and from our side, primary health care. We also noted that the communication is going to be very important. So we captured those things in the white paper as an operational shift. So second message, we're not just saying what, but we wanted to move into how. That brings me to the third message, partnership. All those themes and then the operational shift, WHO alone or health sector alone cannot address. If you think about the themes, pandemic preparedness, obviously we need a partnership. AMR, likewise, hypertension, diabetes, all those things need a partnership. And also operational shift, innovation, technology. Without the partnership, we can't. And strategic communication is also the good example. And if you really wanted to make some changes happen on the ground, partnership. And that's the reason why I'm so excited with this partnership forum. And I'm very much looking forward to the coming 3 days. It's 3 days, huh?
Yeah.
3 days.
Great, thank you very much, Dr. Kasai. Patrick, I'm going to come to you next. The WHO and ADB signed an MOU, a Memorandum of Understanding, just a few months ago about how our two organisations can work together more closely. Can you tell us a little bit about why that MOU, why that partnership is so important from the ADB's perspective? And if I can be a little bit provocative, wouldn't it be easier if you just stuck to finance and we just stuck to health?
Thank you very much. That's a that's a very good question. As a development bank, our entry point into a country is the Minister of Finance, and as WHO, your entry point into a country is the Minister of Health. Dr. Kasai has just talked about three health priorities, emerging health priorities, and those require significant financing. NCDs are extremely expensive to manage. For example, if you look at what Japan, China, and Korea needs over the next 20 years, is about $24 trillion to be able to address those issues. Those are rich countries, but you can imagine our developing member nations, they require more they require resources that they just don't have. So I think ADB working closely with WHO, you as a sector specialist and us as financing specialists, we can combine our efforts to address those emerging challenges as they arise. Secondly, as we work with ministers of finance, we are able to educate the ministers of finance. Many of them think that if you grow the economy by investing in infrastructure, the country will get more taxes and therefore more resources will be allocated to the health sector. But we find that that is not the case, because that's why we have such high out-of-pocket expenditure in our region. So it's very critical that we engage with the ministers of finance to understand that health is also an investment, just like infrastructure, like roads and so on. And therefore our partnership, whereby you do a lot of sector analysis, you do a lot of, you understand the health sector better than we do as a financing bank. You have more expertise on the ground in the countries. We have very few health experts as an organization. So the combined expertise is quite central to ensure that health priorities are financed.
You mentioned that NCDs, for example, are very expensive and are taking an increasingly expensive toll on countries in the region as the incidence of those diseases increases. What are some of the challenges that countries face in financing health generally, and perhaps NCDs specifically?
So if we look at financing, the health sector and the education sector and also the social protection sectors are considered non-productive sectors. And so budgets at a national level is competitive, and every minister has to make a case why they want additional resources. And on the health side, the ministers of health have not been able to articulate a very clear agenda why health is important. So it's very critical that WHO, Asian Development Bank, and other development partners work with the ministers of health to make a case. Because health is not as clear as, for example, in the transport industry, the transport sector, the minister can say that with an additional $1 billion, they'll be able to build more kilometers of road. In the electricity sector, in the energy sector, they can say that more additional households will have electricity and so on. So on the health side, it's a little bit more complicated, because some of the intervention in health, like health security that Dr. Kasai was talking about, not having a pandemic or not having an epidemic is a good thing, but it's very difficult to quantify. So what is the best way by which we can work to quantify the gains in the health sector? So regarding NCDs, because NCDs require collaboration across many sectors, there's a private sector aspect of it, whereby you work with private sector companies to ensure, for example, there's a decreased salt in the food that is being produced, for instance. It requires collaboration with the community groups to ensure that the communities are aware, people are educated that they should go for checkup for hypertension, diabetes, and so on. So it requires significant resources that target many sectors, and I think that that has been the challenge, because if you approach NCD only as a health issue, that becomes a major gap.
Thank you very much. Just a reminder, if you're watching this live feed and you would like to ask any of our guests here this morning a question, please leave a comment in the box below. Let us know and we'll try to get to those questions in a few minutes. But next, let me turn to Dr. Weiler, the WHO representative here in the Philippines. Gundo, the white paper that we're discussing over the next few days emphasises the importance of making an impact in countries, that all of this is for nothing unless we WHO and our partners can make a difference in the countries that we serve. So can you tell us a little bit about here in the Philippines, a very dynamic country with a very dynamic partnership landscape, why is partnership so important to our work here in the Philippines?
Yes, thanks, Angela. Yeah, you're right. Our work at country level is really about making an impact on the life of people and helping the government to provide good and affordable healthcare services, but also to create the environments that keep people healthy in the first place. And in both areas, partnerships are really critical, because in both areas, government and even the health sector can't do it alone. And maybe I can give you a couple of examples from the Philippines. Maybe first on the issue of a healthy environment. So that seems quite obvious that partnerships are really important, because a lot of the interventions that make us breathe healthy air or eat safe food or be safe on the roads, these are all interventions that are not being implemented by the health sector but by partners. So, for example, a recent achievement here in the Philippines was the passage of a law to make child restraints or child seats mandatory in cars, and that to address really the high number of children dying in car crashes and being injured. And that seems like a simple move, but it wasn't. There were so many partners involved in this. We had the associations of crash victims who led the advocacy. We had journalists who provided excellent coverage of the issue. We had parliamentarians who drafted the law and saw it through the process. And we have police actually now enforcing the law. So many people, many different partners involved in making this happen. But even for health services, where one would think, well, this is really more the job of government or of the private sector to deliver, even there, many different partners really need to get involved to make this successful. For instance, we understand now much better that we can only really provide good and meaningful services if those who use the services are also involved in designing the services and even implementing them. So, for instance, we noted that in the Philippines, in some areas, many women give birth at home and not in hospitals, which contributed a lot to high mortality amongst women dying and also infants dying. And we entered into a partnership with local researchers and with the local government. We talked to mothers who told us that really one of the major reasons is they do not go to health services because they can't afford for the transportation or organized childcare. We talked to community leaders who then developed a savings scheme so that would allow pregnant women to save money for transportation. We talked to local hospitals who made the services more relevant, and to taxi driver associations who then organized a transportation scheme. So again, many different partners coming together. I think the point I want to make is that if we think about partnerships, we often think about the big partnerships, the global and the regional partnerships that have a label to it. These are very important, but I would argue that the more closer we move to the ground and to make an impact, the more important partnerships really become. And this is because I think in the real world, our behaviors and our choices are influenced by so many different actors, and only if we involve all these actors in our health interventions, we can make a real impact.
Let me stay on that theme for a moment before we go to questions from the live audience. And this is something actually I'd like to ask all of you. We were talking a little bit before we started the session this morning about, as you've said, partnership is really important, but it's also hard. It's hard work, and there are sometimes challenges involved. What do you all think are some of the biggest challenges to making partnerships work, and how can we overcome those? Patrick, can I start with you on this one?
In the health sector, most people who work in the sector are trained health specialists, and the working across sector requires certain skills that perhaps they don't have, because it requires engagement and facilitation beyond the sector. So, for example, Gunther was talking about issues of child injuries due to accidents. This is a big issue, and a significant role can be played by the World Health Organization, for example. In most cities or in most countries, the transport sector and the police sector, they know exactly where accidents take place. For example, in the Philippines, about 3,000 people die from road traffic accidents every day. In Manila, the hotspots are known. So linking that with emergency services, with the trauma center, so that if there's an accident, the emergency services are ready, and the facility where patients are being taken, they know that there's been an accident, 20 people are coming and so on, to save lives and so on. This requires engaging and talking to people and understanding what are the transport issues and so on. The same applies with the environment. The majority of our cities are very polluted, and how do we engage with the energy department and the environment ministry to ensure that pollution is limited and so on. So it requires certain skills that is a big challenge for people who are trained in health, and that's why during the TAG meeting last week we were discussing that perhaps what WHO could do is basically come up with some sort of a capacity building effort that can train health workers in the country on how do we address some of these 21st century problems that require solutions across sectors.
Great. Anybody else want to take the question on challenges before we go to our questions from the audience? Gundo?
I think what Patrick has mentioned is very important, creating the fora for people to get together. So there's a structural aspect to that, but there's also, I think maybe more importantly, the aspect of attitude, being open to partnerships and really allowing for a sincere and open exchange of opinions. In the Philippines, we've got now for a number of years running the country cooperation mechanism. This is for implementation of global fund grants on HIV, TB, and malaria. And that is a structure where people come together, and people come together who usually do not traditionally talk to each other. And we're seeing a lot of great dialogue happening there, particularly, for instance, between government entities and Department of Health and some of the LGBT communities that are so important because they are very much affected by HIV and TB and some of the other issues. And it's this dialogue, it's really there's an open dialogue, I think that's where people can learn and empower each other. That is good for the services, which are, I think, as a result of that dialogue, much more appropriate now. Here, addressing HIV and some of the other issues. But it's also good for the community because they will also be empowered. And I was reminded of this because we had just last Saturday the Pride March here in Manila, which was the biggest ever since its inception, and it really showed also that I think partnerships strengthen everybody who's involved, and it was good to see a very strong Pride March here in Manila.
Great, thank you very much. So we've got a few minutes before we close for some questions from our audience. The first question is from the Philippines, and the question is, I think it's probably one for you, Dr. Kasai. When it comes to pandemic preparedness, which you mentioned in your opening remarks, what role can partners play in getting us ready for the next pandemic?
Pandemic preparedness, we can think of like a big triangle. The top part is a health sector health response. The second part is the partner support to the health response. And then the bottom big part is that every partners also have to prepare themselves to make sure that they're ready. So if you think of these three layers, depends on the partner's characteristics, the big roles to play. So for example, if there are electricity sector, there are actions that health sectors need their help to make sure all those facilities continue to be prioritized and receive the electricity so they can do operations. But also themselves needs to pay attention that how many of their staff would be infected, and then to minimize that, that helps them continue to operate. So it depends on the different nature of the partners, different roles.
Great, thank you. The next question is from somebody watching in Australia. They ask when we talk about climate change, obviously a very important issue for our region, and especially for the Pacific, as Dr. Kasai mentioned earlier. What aspects of climate change should WHO and ADB be focusing on when we're working on this topic together? I think that's a question for you, Patrick.
Yeah, so several things. Since the question is from Australia, in Solomon Islands, for example, they have a problem in that the country is sinking, and the major hospitals actually might be submerged over the next 5 to 10 years.
Right.
So they've basically asked ADB to provide resources to move the hospital to a higher ground, so that the health system is not completely compromised. Because if that is the largest hospital in the country, and the hospital is affected due to climate change, then people will not have access to healthcare. So this is how we are approaching it. The second thing that we are doing is that we are engaging with countries to develop disaster insurance, so that if there's a disaster, instead of relying on external partners to constantly providing resources when the infrastructure is destroyed and so on, the countries are insured. This is an issue that many countries are interested in. Indonesia is interested in, and several other countries. So I think over time, having an insurance that can support countries would be a good thing to address some of the challenges that we are facing in climate change.
Great. You mentioned the Solomon Islands. I know that there is a big crowd of people in the Solomon Islands in our country office watching this broadcast, so a big shout out to all of them. The next question we have from the audience is from somebody watching from Seoul in the Republic of Korea, and they ask, how can we effectively share best practices, including best partnership practices, especially when those are applied to quite diverse situations and contexts? Gundo.
Well, that's a good question, and I think that hopefully in 3 days we know much more about how we can move forward, because that indeed I think is a challenge. We all engage in partnerships, we all live partnerships, but we rarely have an opportunity to exchange around partnerships, particularly across different areas of health. So I think that's one of the areas where we want to engage more systematically in, and create these platforms and fora in which we can have this exchange, and where we can mutually learn about the successes, but also some of the challenges that we are facing, because I think at the end they're probably quite similar. I would imagine that some of the issues that the road crash victim associations have are maybe not so different from those that people have who engage in the HIV response. So I do believe it's important to create these platforms, and I'm looking forward to learning more about how we can do this even more intensely in the future.
Great, thank you very much. And that is one of the themes of that's really what the discussion about Grounds Up, this Grounds Up group that will be one of the discussion streams starting tomorrow. That's really what that is all about, how we can share some of those local solutions and see how they can be applied more broadly. We are almost out of time, so I want to wrap up by asking each of our three panelists one last question. And that is, when you think about this Partners Forum, which is something quite new for us, we haven't done a meeting quite like this before, completely online, hundreds and hundreds of partners joining us from all over the world. What do you hope to see out of the next few days? So let me maybe start with you again, Gundo, if that's okay.
Yes, of course. We call it the Partnership Forum, but there is not one type of partnership. I mean, for me, there are thousands of different types of partnership. So for me, the beauty of this forum and the possibility to have so many people engaged from so many different countries is, first of all, to learn about the whole range of partnerships that are important for health, to learn how these partnerships make an impact on the real life of people, and of course to learn how we as WHO can foster those partnerships even more efficiently in the future.
Great, thank you very much. Patrick.
This is an incredible audience to have almost 950 people engaged in discussions to identify and reinforce some of the priorities that have been identified by the RD and WHO regional office. I think is extremely unique, and it basically it will showing us the pulse of Asia and the Pacific. What are people thinking? What are some of the big issues that they are worried about? And as ADB, we would like to also understand what's the pulse of Asia and the Pacific, because that is how we prioritize our financing for health, if we know what countries are seeing as priorities. And just lastly, I think that the biggest challenge that we are facing is that the current emerging threats in health, health security, NCDs, the four things that Dr. Kasai has talked about, the education sector is not producing some of the experts who are knowledgeable to addressing those issues. So how can collectively ADB and WHO engage with the education sector to produce the health workers that are needed in the 21st and 22nd century?
Great, thank you very much. So I want to give the last word to the regional director, because this forum was actually his idea to bring everybody together in this way. So Dr. Kasai, what do you hope to see out of these next few days?
Okay, we want to work for the future. Patrick, I think he mentioned that the health sector is investment. It's true, if we only respond to today, it's a cost. But if we think about the future, this is the investment. And of course, there are issues that in front of us, we have to respond, and partnership is also important for that. But in the coming few days, I'm very much looking forward that partnership for the future comes out.
Great.
And I'm excited for that.
Thank you very much. I'm excited too. That brings us to the end of this opening session. Thank you so much for joining us. Thanks to our three panelists for being here. They'll all be online on and off over the next few days, so look out for them. Dr. Kasai has said he'll pop in and out of as many of the discussions as he can, so get more questions ready for him if you have them. Thanks to everybody who's been here watching and listening. We really appreciate you being here. As we've all said, this is the first time we've done a meeting quite like this, so we know we're going to learn a lot over the next few days, and we're really happy that you're here to be sharing that learning journey with us. So the first 4 discussion streams kick off right now. You can find them on the bar to the left side of this live stream. Head over there, the moderators are waiting for you to join them. Those are the discussion streams on health security, on NCDs and aging, climate change and health, and the unfinished agenda of infectious disease and infant and maternal mortality. Please join us back here tomorrow at 10 a.m. Manila time for the start of our Youth Town Hall segment. very exciting session, which we're also really looking forward to. That's all from us for now. Thank you so much for joining us.
Thank you very much.